and kind of where we are in this moment. Just a quick word about our guest, Melissa. Melissa is Sharsheret's Director of Community Education, and she has a master's degree in Jewish Communal Service from Brandeis University and has been working in the nonprofit sector for 30 years. Her professional experience includes informal education, advocacy, and community outreach. Melissa's work has allowed her to facilitate unique and lasting connections among organizations in the diverse American Jewish community. Melissa oversees outreach efforts throughout the country, amplifying Sharsheret's reach and connecting as many as possible to the support and resources of Sharsheret. Herself a breast cancer survivor, she is passionate about the Jewish community and cancer support and advocacy. Again, Melissa, thank you for joining us. We are still in this heated moment of a global pandemic where women's health issues have been compounded by communal and global health issues, physical health, mental health, emotional health, and I would love to hear from you kind of the lessons that you have learned and the teachings that you want to share with us.
Thank you so much to both of you for welcoming Sharsheret and myself today. You're right, this is an important and rapidly changing conversation, but I'm so glad that everyone has joined us to take this moment to learn how to be more proactive. So today I'm going to do a few things. We're going to introduce you to Sharsheret, discuss why breast cancer and why women's health are Jewish issues, discuss how to determine personal risk and, more importantly, how to manage and mitigate it. And we're going to share all of this through the lens of, like Daphne was saying, our global pandemic. But for those of you who don't know, Sharsheret is the Jewish breast and ovarian cancer community. We are the only organization in North America that offers culturally meaningful support to Jewish women and families facing breast or ovarian cancer. And sometimes we'll get the question, well, why do we need a Jewish organization? There are lots of great breast cancer organizations, and there are, and we work with them. But there are two main reasons. One is a genetic reason, in that we carry a mutation more commonly than the general population, one that leads to increased risk. And the other is about specific cultural or halachic concerns. Everybody deserves, no matter what they're going through, everybody deserves culturally meaningful support. And in fact, studies have proven that patients whose non-medical needs are met actually do better medically. When we think of non-medical needs, we often think of things like finances and childcare, and they are, but people forget that religion and culture are also non-medical needs. So I want to give you a super quick example of what culturally meaningful support might mean. We just went through the Chagim, the high holidays, and very often we'll get calls from women at the start of the season. Women who have been to synagogue every year during the high holidays for their whole lives and gone through the liturgy and said it and davened with kavana, but this year they're struggling with part of the liturgy because, of course, unatana tokef, who shall live and who shall die, takes on very different meaning if you have been diagnosed with a life-altering disease and possibly life-threatening. So that's one example of working with women about how to reframe that part of the liturgy. Again, there are so many examples, that's just one. I want to point out with regard to Sharsheret that we work with all women and families facing breast or ovarian cancer or genetic concerns, no matter their connection to the Jewish community, unaffiliated through ultra-Orthodox, and those with no connection as well. Our programs are open to all. And we work with all stages, people who have not been diagnosed but are concerned about risk, people in the diagnostic process, during treatment, those with advanced cancer, or into survivorship. And we do so through an amazing team of social workers, a genetic counselor, and through formal programs that help women and their families navigate the cancer experience. And toward the end, if we have time, I'll talk about some of those specific programs. We also do a lot of education and awareness raising in the general community through lots of opportunities, a lot of symposia online these days, webinars online, and also programs such as this. But I want to get a little bit more now into the meat of the conversation and start with a story, my story actually. So listen, everybody has what we call a Sharsheret story. It may be that you know someone out there who was helped by Sharsheret. Some of you on today's webinar maybe even were yourself. Or maybe this is the start of yours and you'll continue to be involved in spreading awareness and education on this important issue. But my Sharsheret story started 6 years ago when I was diagnosed with breast cancer. My diagnosis was actually the direct result of treatment 17 years before that for a different cancer. And during that cancer treatment, I received radiation to my chest. So what happened when I was done with my first treatment was that my oncologist and we really had a pretty complex conversation about my future risk and how I was going to mitigate that risk. And for me, among other things, it meant starting screening much earlier than the average person and not just doing mammograms, but alternating that with MRI so that I had a screening every 6 months. It was actually the MRI that caught my cancer very early, thank goodness. It wasn't even big enough to show up on a mammogram. I was not working. I was working in the Jewish community, but not yet for Sharsheret. And I relied on them during treatment. And they were incredibly helpful. And then when my health was restored and I was done with my treatment, they actually advertised for a new position and it felt very beshert. And I took my skills on over to Sharsheret. So I share my story with you, not because it's important for you to know my story, but the nuance within my story is that I knew what needed to be done for me. Had I followed general suggested guidelines for breast cancer screening, it would have been a very different outcome. It would have been years before my breast cancer was caught. I knew how to monitor myself for my own needs. And that's really what I'm asking, what I'm going to teach you how to do today. If you take one point away from this program, it's to take personal responsibility for your health. So I want to remind you that Sharsheret offers no medical advice because we're all different and that's not the role we play. But that's why I'm asking you to do the following things. I'm gonna talk about some of the ways we can be proactive, we can be empowered. And so because we don't offer medical advice and we don't necessarily fall into general guidelines, I'm gonna ask you to know yourself and your family history. So let's start with family history. So if we took everybody on this webinar today, men and women, I'll assume there's some men on the webinar, men and women, people who are Jewish, people who are of other religious faiths, people who are of from other cultural backgrounds, about 1 in 500 of those people would carry a mutation on one of their BRCA genes, 1 in 500. For Jews specifically of Ashkenazi descent, that number isn't 1 in 500. That number is 1 in 40. That's a significant difference. And although hereditary breast and ovarian cancer diagnoses are a very small percentage of all breast and ovarian cancer diagnoses, if one does carry a mutation like that, their lifetime risk, their risk of a breast cancer diagnosis over the course of their lifetime is up to 88%, which is versus about 12% in the general community. And for ovarian cancer, that number is up to 45% versus less than 2% in the general community. So it's important to know your family history. Talk to them, learn what cancers have been in your family's history, what the age or decade of diagnosis was. We do that because we're not nearly as worried about a mutation if everybody's cancers were in their 60s, 70s, and 80s as we are in their 30s or 40s. And by the way, don't just ask about breast or ovarian cancer. We ask you to ask about everything, and I'll tell you why. Because when the BRCA gene was named, we knew there was a connection to heightened risk with breast cancer. Shortly thereafter, we learned there was also a heightened risk for ovarian cancer. We now know that in addition to those two cancers, there's a heightened risk with BRCA mutations for prostate cancer, pancreatic cancer, melanoma, and male breast cancer. So the point is that a cancer diagnosis that seems irrelevant today might actually be very relevant a few years from now as we continue to learn more. And like I said, Sharsheret offers no medical guidance or advice, but we feel strongly that you should make your decisions from a place of knowledge. And a place of knowledge is knowing your BRCA or other mutation status. There are other mutations as well. And the way to learn your status is to see if screening is warranted. So the first way to do that, again, is to, excuse me, is to know your family history. By the way, there's a great opportunity coming up to do that. So in just about a month, we have Thanksgiving, where all of you will virtually gather over Zoom to possibly enjoy a meal with your family. So I recommend that this is a great time to do it. The election will have just passed, and we know that families and politics don't always mix. So instead of talking about the election, talk about something that might be life-saving. Okay. I'll tell you that one way you can think about this is as a gift to children and grandchildren. So some people think, oh, I'm older, I don't need to be tested already. At this point, like, it doesn't matter. And if you know your BRCA status, then that's helpful to your children and your grandchildren. It gives them a leg up in determining theirs. So you can almost think about it as a gift to them. Okay, so know know your family's status. By the way, on the Sharsheret website, you can download a medical family tree. And that will give you all the places to write down the information that you will then share with your doctor. In addition to knowing your family cancer history, you need to know what's normal for your own body. Listen, even without BRCA or other mutations, because like I said, that's still a small part of small percentage of the diagnosis, you need to be concerned, because 1 in 8 women, BRCA or other mutation or not, will be diagnosed in their lifetime. So how can we be proactive here? Well, being aware what's normal for our bodies, all parts of our bodies, because you can't know if there's something of concern unless you know what normal feels like for you. There are obvious changes we've all heard of. There are also subtle concerns. So I just want to go through a couple of symptoms to be aware of. We are all familiar with the idea that a lump might be breast cancer. I want to point out 2 things. One is there are a lot of reasons that women get lumps in their breasts, and most of them are not breast cancer. So if someone does find a lump, please don't panic. It may warrant a conversation or a visit to a doctor, but it's not a reason to panic. I also want to point out that that lump or any symptoms, and we'll go through a couple more, might be beyond where you would normally consider the breast. It could be in the underarm, above or below, and that would be a reason to make a phone call to a doctor too. But also a change in skin tone on the breast or color, a rash, dimpling, a thickening of the skin, anything, or any unexplained change of size in one breast. Also, honestly, the feeling that something is not right. So, okay, you have learned your family's history. You're now familiar with your own body. This is the time to have a conversation with your doctor, whether it's an OBGYN, whether it's an oncologist. If there's a reason you should have an oncologist, you don't go to an oncologist with this unless you have a relationship, or whether it's a primary care physician. Share that information with the doctor and together come up with a customized screening plan. Because Jews of Ashkenazi descent have such a higher risk of mutations, what we see online, what we hear on the news may not apply to us. And depending on all the information you bring to your healthcare provider. You might decide that genetic screening is right for you. And then you have that information as well as you create a screening plan. And it may well be that the doctor says, you know what, you can follow a standard course of screening. It may well be the doctor says, I want to start a few years earlier, or I don't think this is right for you. I want you to have this test instead of that test, or I want you to have this test in addition to that test. And then you stick to that plan. In fact, that's the number 3 in our list. So we've learned our family history, we know our own body, and we've had the conversation with our doctor about it. Now that you know what your screening plan's going to be, I'm going to ask you to commit to the appropriate screenings and not push them off. I know that it is so easy to do. We're feeling well. We don't want to go for an uncomfortable test. We may be using COVID as an excuse, which we'll talk about a little bit later. But part of being proactive is making those appointments and not delaying them, and not canceling them. And I think that the way to look at it is twofold. One is, listen, there isn't a person on this call who would let a child or grandchild's lingering cough go without a visit to the doctor. So certainly, if someone has a concerning symptom, they shouldn't put off a visit to the doctor. But also, with regard to our own screenings, we shouldn't put those off. And I know as women, first of all, it's difficult to put ourselves on our own to-do list, but we have work commitments and family obligations. We've made volunteering part of our lives. We're busy. But you can't take yourself off your own to-do list. And if for whatever reason, that's not enough of an incentive for you, I wanna reframe it. So how is it that we're going to teach our children, our grandchildren, the women we sit next to in shul, our neighbors, our colleagues, that it's okay to care for themselves if they don't see us caring for ourselves? This is a modeling behavior. This is a leadership behavior, right? So many people take this without even realizing, do as I say, don't do as I do, with regard to how we teach our children or grandchildren things. It's not enough to say to your 14-year-old daughter or granddaughter, it's time to start going to doctor's appointments, or your 25 or 40-year-old child, it's time to schedule your first mammography, if they haven't seen you do it. It rings hollow. And so this is really a very important behavior. The fourth thing I want to talk about, right? We've done family history, we've done knowing your own body, we've done committing to the appropriate screenings, is healthy living. We need to be proactive about all of our health, not just our breast health. And the good news is that the things we're going to talk about now don't just reduce risk of breast cancer, but all cancer, and heart disease, and diabetes, and dementia. These are win-win behaviors, and there's really no excuse to not participate. So the first thing I'm going to tell you is eat well. That doesn't mean you can never have dessert. Certainly, dessert is warranted. But I don't know, what's our next holiday? I guess the next big one is Hanukkah, right? You don't have to have sufganiyot every night. You pick one night or things like that. Basically what I'm telling you is make sure that the majority of the time you eat, your plate's filled with lots of colorful fruits and veggies, whole grains, lean proteins. And if you stick to that, then you can have that donut or those latkes every once in a while. I'm going to tell you to be active. Again, it's not like you have to run a marathon unless you want to, and then let's talk about Team Sharsheret. But I'm asking you to take a walk after dinner every night, or with your friend before your day starts. I see in my neighborhood women every day, walking together, but on opposite sides of the street by opposite curbs, and just talking and catching up and keeping their exercise going. And that's amazing. The last part of this is reducing stress wherever possible. Now, this may be the most difficult part, believe it or not. especially in an age of COVID. But we know that stress impacts disease development in a significant way. And there are a lot of unique opportunities today that we didn't have before COVID. I mean, you can find free online classes that are for meditation or yoga. We just hosted a Zen doodling program, which is meditative guided doodling. Very cool, very relaxing. So there are a lot of other opportunities that we may not have had before, but you always have the option of closing your eyes and just breathing deeply and slowly. And you can actually, if you do it just 3 times, 3 slow breaths in, 3 slow breaths out, you can feel a change in your body immediately. So you know it's working. So all of these things that we spoke about lower your risk, and in some cases dramatically, whether you carry a genetic mutation that raises risk or whether you don't. Either way, these behaviors lower risk. Obviously and unfortunately, they can't prevent all diagnosis, but should a diagnosis occur, it will happen earlier when treatment might be less invasive and when survival rates are at their highest. And of course, being healthy gives you the strength to heal. And I want to talk for a couple of minutes about, well, it's a new addition to this presentation. It's helping and healing in the age of COVID, and it's really related. So sadly, 2020 has presented us with so many unexpected challenges, and also, interestingly, so many unexpected connections to the cancer experience. First of all, it's been a glaring reminder to all of us that we need to be proactive about our health. And I don't often talk about hand washing and mask wearing when I talk to the general community about cancer, but knowing that this has been drummed into us now, it's a reminder about all the ways we can be proactive to protect our health. And I do want to say that COVID is not an excuse to postpone healthy living. You know that in some parts of our country, routine cancer screenings are down as much as 90%. That figure blows my mind every time I say it. And the NCI, National Cancer Institute, believes that COVID is going to negatively impact cancer deaths for the next decade. That's due to delayed diagnoses and altered treatment plans. I just want to emphasize, and Sharsheret actually last night did a webinar and this was addressed. It is currently safe to be screened. This cannot be used as an excuse. Granted, at the beginning of the pandemic, we did screening, not diagnostic, but screening mammograms were put on hold, but they are not anymore, and it is done in a very safe way, and no excuse. Also, more time to cook, no excuse not to experiment with healthy foods. Like I said, you could walk with someone living in your house, or even slightly distance with, a friend or a neighbor. A lot of opportunities now to live healthfully that maybe were a little more difficult before. We're also more aware, though, of those community members that need a little extra support. People currently facing cancer or any diagnosis are more isolated now than ever due to the risks associated with leaving home. These are scary times for everyone, even scarier for someone who's immunocompromised. So what can we do? We can check in on them with a phone call, offer to do shopping, or do a door drop of a meal. Another interesting connection is that now we're all in need of healing. Just like with cancer, healing can be physical for those affected by COVID or another diagnosis directly, but we're all living at the moment through a collective trauma. And healing can also be emotional, and it can be spiritual. Every person is different in their healing needs, but one thing is true for everyone. Healing is not linear, and everyone heals at their own pace. Interestingly, cancer survivors, cancer thrivers may well have something at this point to teach us all, as they're used to living with that uncertainty, and they're used to living with concerns about germs and hygiene. With their experience, it may be that they can help us learn how to deal with this new normal we've been presented with. It's important to recognize that when a member of the community is diagnosed with cancer, with COVID, with anything, the entire community is impacted. Interestingly enough, they're impacted that now, not just because of the emotional impact, but because of the physical impact, right? We've all gotten emails from our congregations or from our children's schools or places of employment that somebody was diagnosed and now we have to go into lockdown, or please be aware, or whatever it is. But also there's an impact emotionally. It makes us feel vulnerable. Illness in general stirs difficult emotions in all of us, whether it's fear, sadness, a feeling of loss. Additionally, and this is something that we don't always talk about when we talk about cancer, but additionally, our communities around the country are currently experiencing, like I said, collective trauma, but we're also processing this loss of physical community through Jewish life. And that's something that's very unique. Not necessarily for someone who has cancer, who might not be able to go to shul in the past because they're immunocompromised or too weak to make it to shul. But now we're all experiencing it. No matter what the cost of the pain, communal healing is a critical way we support the mental health of our members, and we're all hearing more and more about mental health as this pandemic drags on, but also to protect the overall well-being of our community. Again, time is a big factor in healing, but there are so many proactive things we can do today as a community facing COVID, and as we move forward and beyond COVID, to those who are isolated in our community due to illness. So for members facing illness, again, whether it's COVID, cancer, something else, organized community support is a great place to start. Meals, rides if necessary to treatment, things like that. Homework, virtual homework help for children, whatever it is. It's a great place to start. It provides the community with an opportunity to support someone in need and feel like they're being useful. Collective prayer through Tehillim or a special healing service, which can be done online outside of Shabbat, is also a strong resource. In addition to feeling sad or concerned, community members may be worried about their own health. Listen, if it's COVID, it's clear why they're worried. But if it's a different diagnosis like cancer, it may be that, someone we know is diagnosed, and all of a sudden the fact that we haven't done our annual mammogram, or that we remember that one of our relatives had it, or just that we're getting older, or whatever it is, triggers some fear in us. And that's completely normal, but it means that these healing programs can be useful for not just those who are ill, but for all community members. And a community may want to use the opportunity to raise awareness. So if somebody's diagnosed with breast cancer, a community might do a program like this. If somebody's diagnosed with COVID, they may choose to do a program re-emphasizing what we can do to protect ourselves these days. For whole communities facing collective trauma, as we are today, the importance of connection cannot be understated. Finding paths to ensure our sense of community should be a priority, whether it's through Zoom programs, religious, educational, social, or finding safe opportunities to support those who are particularly isolated. This is critically important. When someone's diagnosed with cancer, they automatically feel different, right? They're all of a sudden thinking about different things than the general community is thinking about every day. And they feel isolated emotionally or mentally, but then they may actually be physically isolated for a variety of reasons. That sense of isolation it can be for some as painful as the diagnosis itself. And our goal today, whether it's for individuals who are facing cancer or another diagnosis, or for the pandemic situation, our goal today is to remind people who are ill that the help we provide them isn't just a chesed opportunity for us. It's because they are still valued members of the community. Their diagnosis changes nothing with regard to that. And by the way, that starts the sense of healing immediately. That is so important. And I just want to say that it's important to note that the support and the connection skills, I don't know if that skills is the right word, but skills that we learn during this unprecedented time, they need to continue. We need to continue using them for anyone facing illness but beyond the time of this pandemic. During this time, we've gained insight into the lives of people who face illness, and we need to make sure that we continue using what we've learned to make those people feel a part of our community. Okay, so I want to take a break here, see if there are any questions, and then I do want to finish up by telling you a little bit about some of the Sharsheret programs. But right now, I want to answer questions, whether it's about women's health in general, being proactive about breast cancer, healing and COVID, whatever there is.
Sure. So I think first a comment and a question.
Please.
One of the things that we have experienced, in particular during the surge, but even in the months since the surge, and the surge is in flux depending on where you are in the country. I want to note that, and also that you and I are in different parts of the country where our numbers are going up, is that people are increasingly living in and staying in isolation. And so what are your recommendations in terms of both, people want to both maintain their privacy and also are in need of help, and also now have this added component of we actually have to distance from each other. So what are some of your best advice from the, from your experience in the work that you've done?
Absolutely. So, I think that isolation, we've heard study after study just in the last few months that isolation as it goes on continues to impact negatively on mental health wherever a person was before the pandemic came on. And we need to do our best to mitigate that isolation. So from an individual or family perspective, I know that we now do Zoom calls on a regular basis with friends, with family members. I read stories to my grandson. We play online games, interactive online games with friends, simply because it's a way to make it feel more natural, right? Like you can sit there and sort of have a Zoom conversation with a group of friends, and after a few minutes, it feels kind of awkward because we're so used to these things being so natural. And there's nothing natural about sitting with a group of people you've known your whole life or the last 20 years or whatever it is, and just staring at each other. So finding things online you can do that are really interactive and make it feel more like it's a game night on a Motzei Shabbat and you're all together. It's just you're together in a different way. I think that we also need to be aware that although those connections are so critically important, and I encourage them however you can do them, I know many congregations are doing online programming, Saturday night programming, learning during the week, whatever it is. But you also have the right to draw the same barriers or boundaries is the word I wanted to use, that you did when you could go to a Malava Malka or, go out with friends or whatever it is. You don't have to say yes to everything. There is certainly such a thing as Zoom fatigue. In terms of those who need extra help physically, as opposed to just need to relieve that sense of isolation, which again is very painful and legitimate. But I would, well, yeah, absolutely. I would say that that a good way to do it is to connect with someone, like whether it's a shul committee, a rabbi, a best friend, and sort of have that person parse it out. Because if you are needing that extra physical help, no matter your diagnosis, you may not have the energy to kind of manage that yourself. And in the past, we know that if somebody's been diagnosed with something like cancer, it's usually someone else who steps up to manage those kind of details. It's no different today. And so I think that that's a good thing to do, and use all of those regular channels that you would in a different point in history. Yeah, I absolutely think that.
Okay. And a question, you touched on this before, but I think it's so important. I'm going to ask it in a different way. Somebody who wants to be proactive, but still doesn't want to be in a medical environment unless they really have to because of the pandemic. What is your recommendation?
Right. So that's actually a legitimate fear, and a fear we hear a lot. And I think the best thing to do is a lot of doctors are actually doing telehealth right now. And you can set up a telehealth appointment to have a conversation about what must be done now and what could wait. So if you set up an appointment with a telehealth appointment or a telephone call, some doctors will take calls with any doctor. You can say, okay, so here are the things that I should be doing, that I know I should be doing. Tell me what I can wait on and tell me what I shouldn't be waiting on.
Mm-hmm.
And then once you know what you have to do, then make those calls to those offices and make sure, call the radiology group and say, what are you doing to make sure that people are healthy? And they should be comfortable telling you those steps. You also need to be comfortable. Unfortunately, we're learning as we go out into the world, whether it's the market or whatever. If somebody is encroaching on your space, you could say, would you mind giving me a little space, or things like that. Theoretically, at this point, most doctors and offices, medical offices, have worked it out so that shouldn't even happen. But again, just like you advocate for yourself in a health environment, you need to be advocating for yourself wherever you go to keep you safe from COVID, whether it's the supermarket, the doctor's waiting room, whatever it is. And that's an important thing to know too. The self-advocacy kind of goes across the board. There are some things that can wait. I personally delayed a dental appointment because I didn't feel comfortable, but now it's been 6 months and I don't want to put it off anymore. And I called and I asked, and sure enough, they're doing actually way more than I would have thought. And so I'm comfortable going. It's the same with other things, right? Like a doctor might say, okay, I don't want you putting off a mammogram, but if you want to put off your bone density for 6 months, okay, that's fine. And so be comforted that we're so far into the pandemic that the medical professionals know what to do, right? They didn't know at the beginning, which is why some screening mammograms were postponed, but be comforted that at this point, they wouldn't have said they're allowed unless they really knew what they were doing. And I did share earlier, the amount of screenings that have been reduced and how that's going to negatively impact. I am sure that all of our mammograms are going to be fine, but don't risk it. Don't risk it at all. And honestly, if you're still concerned after all of that, it may be that you need to talk to somebody to get through this fear. And that's perfectly okay. None of us have experienced this before, right? And even the last time there was there were two smaller pandemics, the swine flu and whatever the other one was, they didn't impact us like this. And the last time there was a pandemic like this, we didn't know enough medically. So literally none of us have been through this. There is no shame in reaching out to talk to somebody to get through our fears and anxiety in a situation like that.
Thank you. I'm glad that you added that at the end, the importance of recognizing that this is new for all of us, that there are things that we know and there are things that we still don't know, and it's so important to ask for help at whatever access point that we need it. So tell us more about upcoming Sharsheret programs.
Okay. So, well, first, before I do that, let me just tell you a little bit about what we do. So in addition to these programs like this, For someone who's directly impacted, whether someone carries the diagnosis themselves or they're a caregiver or they're concerned about genetic status, we have an amazing clinical team. We have a team of social workers and a genetic counselor that take calls all day long, answer questions, offer support. And then we have a series of more formal programs that help women and their families navigate through the cancer experience. Everybody attends, and these programs are appropriate for anybody facing breast or ovarian cancer or impacted. Peer support, a caregiver's program. By the way, redefine caregiver. It's not just a spouse or partner. It's also a parent, an adult child, a best friend. We have a program for women living with metastatic disease. We have a genetics program for women who have those concerns. We have an amazing program called BusyBox for women raising young children while dealing with a cancer diagnosis. The children get age and interest appropriate toys, and the adults in the household get information about how to talk to children in a developmentally appropriate way. So many and so much more, but those are a good few programs that we offer. All of the support we offer is 100% individualized, 100% confidential. You even have the option to be anonymous, and 100% free. And these are for anyone, like I said, facing a diagnosis, whether you have support where you live or not, this complements it. The other part of Sharsheret is this education and awareness, and we are doing a ton of webinars these days, educational webinars. We have, this week we did two already. We did one last night on creating a customized screening plan, something that I talked about a little bit today. We've done all sorts of programs on, well, I told you we did the Zentangling one, and we've done creating a caring community and COVID and cancer updates. Couple of programs that might be of specific interest. So we just started doing, when the pandemic began, some public Jewish programming. And our third time, we're doing it quarterly, a program called Shalom Shabbat. And it's an opportunity to reset before Shabbat, no matter what you do regularly in your Shabbat observance. And there's a different theme each time. We have one next Friday, the 30th. And the theme is Hidur Mitzvah and using music and song to enhance Shabbat and life in general. If any of you are medical professionals, we are having a national cultural competency training on the 28th, which can give you free continuing education credit. So definitely reach out if you're interested in that. And then on November 16th, we're doing something a little different. We're doing a program called LOL, Links of Laughter. And we have people from performers from Netflix and SNL, really doing a comedy show to support Sharsheret's programming and to give everybody a much needed opportunity to laugh these days. All of those programs you can learn more about on our website, which is Sharsheret.org. And I'm going to spell Sharsheret simply because it's a transliteration, so not so easy to spell. It's SHARSHERET.org, or you can email me at mrosen, MROSEN, @sharsheret.org, and I can share some more information.
Wow. Well, Melissa, I want to thank you so much for joining us this afternoon. I want to thank you for sharing all of this valuable and life-saving and life-enhancing information. And again, for people who want to learn more about Sharsheret, you should visit their website, www.sharsheret.org. You can also check our website for our upcoming programs. And I look forward to speaking with you once again soon. Thanks, Melissa.
Absolutely. Thank you. Everyone have a wonderful day.
You too. Bye.
Bye-bye.